Hello, dear doctors, and welcome to our session for today. We came back with a strong return. We used to do very helpful approach-based group mocks, and now we are adding teaching sessions on exam topics. Hopefully, you will benefit a lot by consolidating your knowledge and enhancing your exam technique after attending and participating in these sessions. As you all know, that our topic for today is falls. Falls is one of the heavy topics. Many people struggle in mastering this topic. Hopefully, after the teaching session and after the next mock session, you will find falls is one of the easiest topics, and you can practice on all of the falls stations without any problem. Hopefully, all of the confusion will be cleared. You will not have any doubt, any kind of confusion about falls, and you can deal with falls if you have it in your exam, inshallah. All right? What I'm going to do now, because I receive many messages about the course, either the full course or the practical course. So I'm going to make a kind of small intro about me and what I do provide. Then I'm going to enter into the core of the session. All right? So my name is Dr. Sahar Ali. I am working in the NHS in one of the hospitals in acute medicine unit. I am a simulation faculty for the junior doctors in my trust. And also I am PLAB 2 instructor for more than 4 years now. Alhamdulillah, I have helped many people to pass their exam, and many of them passed without any additional courses or academies. Alhamdulillah. I am the founder of PLAB 2 Warriors groups. In these groups, I do provide PLAB 2 Warriors courses, PLAB 2 Warriors one-to-one mocks, and free mocks as well. And all of them are rated as outstanding. Alhamdulillah. These are some of the wonderful feedback and amazing success messages. Hopefully, we celebrate your pass in my group, either by taking my course or with another course or without any course. You can have a look quickly. If you're interested, I do have the full course and the practical course, okay? In these courses, you find high fidelity simulated scenarios. All of the scenarios are done by me using the 8-minute spell of the GMC. So you can feel the time pressure, okay? And you know how to deal with the patients properly in 8 minutes. In the practical course, you find me using the SimMan and the monitor in a simulated scenarios. So you can feel the pressure of dealing with acutely unwell patient. I use also the mannequins to do examination on them. Teaching sessions as well have been added to the practical course lately. In the courses, you find these lovely mind maps. They are organized, systematic, to the point, easy to remember mind maps. As you can see, each mind map is divided in 2 halves, as the station should be done in the exam, half for the data gathering and half for the management. You will find in the data gathering that all of the information which is important to each case is written. In the data gathering, you find the most important points in each category of the history taking, in terms of the present history, the past history, the personal history, all of the categories. You find the most important things are highlighted, okay? Then in the examination as well, the most important points in each specific case and investigations as well. After that, the management. You will find the diagnosis. You find the, it's written, or I give you an idea about how to deliver the diagnosis in this case in a proper way. Then the management points for each case, based on each case. All right? Lately, I have announced about 3 new services. The first one, which is happening now, the free teaching sessions. The second one is the course prescription training for the course subscribers. They will be conducted by a well-trained instructor every week. So you can master the prescription. It's a kind of training and correction, okay? Then lastly, the online exam mocks. These mocks will be conducted by team of instructors who all passed at least 15 or 16 stations or scored more than 130. The mocks will be the same style of the exam, and the feedback will be to the point. Okay? So you have always been in safe hands, and you will be in safe hands. Everyone in the mocks is trained on the assessment criteria. So everything will be amazing, inshallah. All right? Okay. What I want to convey to you is that the main factor to pass this exam is you. Your hard work, your commitment, and your practice. If you succeed to do this, what by that I mean the hard work, the commitment, and the practicing, the high quality, not quantity. If you can do quantity and the quality, it's okay, but the quality of practice is the most important thing. And we can talk about the quality of practice later, all right? But if you succeed to do this without any aid, without any courses or academies, you can pass from the first attempt. If you cannot afford taking courses, if you cannot afford going to the academies, if you cannot afford to take private mocks, this is not the end of the world, all right? Many people took everything in terms of courses, mocks, academies, and they didn't pass because they relied on these aids and they forgot the main factor, which is themselves. The main factor to pass is you. As I mentioned, your hard work, your practice, your commitment. The people who didn't pass with taking courses in academy, they just relied on watching the videos of the courses, listening to many mocks and listening to many mentors, and they ignored their role. They ignored their practicing. They ignored that they have to be committed on their practicing and enhancing their exam technique, all right? So the main factor to pass PLAB 2 is you, after God willing, okay? So Be aware of this. All right. If you want to join our YouTube channel, you are more than welcome. It's named PLAB 2 Warriors. You just need to click on the playlists. You find many useful videos. For my videos, there are 2 playlists. One is for the free mocks, the recorded free mocks, and one is for the marking criteria. You will find many videos about PLAB 2 exam, how to prepare, and tips before the exam. Okay, this is for the YouTube channel. Let's dive into our plan for today. In this session, we are going to talk about falling or falls. I'm going to teach you how to deal with falls. If you have a case of fall in the exam, how to deal with it, and how to reach the provisional diagnosis. And after that, we will have a mock, 1 or 2 cases based on the time, all right, as the time allows us. Okay. Let me share the links of the groups first, and then we can start talking about falls. All right? Falling or falls. Remember this picture, doctors. Okay? Why? As you can see, the patient is elderly, old patient. Usually, you find falls are common in old people. Okay? So please, you have to be minded by the age of the patient. Why? If the patient is elderly, you have to think about the psychosocial part. It's very important. It's very important. You have to find out, is that patient living alone or not? Who looks after him? Are there any carers to look after him or not? Okay? Because it's unsafe to send that patient to his home if he is living alone and he has recurrent falls. All right? Here in the UK, the psychosocial part is very important. You have to think about and you have to ask it in almost all of the clerking, okay? So please be minded of this. All right? We all know that the case should contain the history taking, also examination and investigations, then management. Okay? In the history taking, we have some categories: present history, past history, personal history, which is diet, exercise, smoking, and alcohol, I mean lifestyle. Then 4 Ps, and this category is only for females. What are 4 Ps? Are period, pregnancy, pills, and pap smear. All right? These 4 Ps, you can think about them if you have a female patient, and you can skip some of them. All right? So it's based on the situation and the symptom that you deal with. All right? Then psychosocial. In psychosocial, you think about what? You think about the effect of the problem on the daily life activity, on the job, and you can add effect on mood as well if it's chronic problem. All right? What else you think about in psychosocial? Especially in elderly patient, you have to think about, who does the patient live with? Who looks after him? Is he dependent or independent? Because this will affect your management. If the patient is living alone, he has recurrent falls, no carers are involved, so you have to involve the OT-PT team What is that? Is the occupational and physiotherapist. They will be involved. They will do some adjustments or some strategies to make sure that this patient is safe to go home. All right? This is in terms of psychosocial. Then ideas, concerns, and expectations. All right? Do you have to ask all of these categories in each case? The answer is no. It's based on the situation, on the symptom, and on the context. In some cases, you can skip lifestyle. In some cases, you can skip 4 Ps. In some cases, you can skip psychosocial. Okay? If we can say what are the most important 4 categories that you need to ask in each specific case, what are they? They are the present history, the past history, psychosocial in some cases, and ICE, ideas, concerns, and expectations. All right? In the present history, what you think about? You think about exploration of the symptom. You have to explore the symptom very well. After that, you exclude the red flags that are related to the symptom. Okay? This is in terms of the present history. What I mean by red flag, I mean by this, the emergency symptoms or emergency thing that or the emergency differentials that you need to exclude. All right? This is in terms of the present history. In terms of the past history, you think about if this problem happened before or not, any medical condition that the patient has, any medications that the patient is on. You can also, accompany the past history with the family history. Okay? And when you ask about the family history, specify what medical condition that you ask about. Okay? Family history is not important in all of the cases. It's based on the symptom, to be honest. If it's a chronic problem and one of the risk factors is the family history, you can ask about family history. All right? This is in terms of past history. We have talked about the personal history. It's diet, exercise, smoking, and alcohol. 4 Ps, we have talked about it, and psychosocial, we have talked about it. All right? Then you move on to the examination. When you examine, you have to mention what are you going to examine exactly in this case. And usually put this structure in your mind in terms of the examination. You have to verbalize. I would like to check your observations and examine the local examination which is related to the symptom. All right? Let's say that this patient has a fall. We have fall now. We are talking about falls. So what is the examination which is related to falls? Checking observations, especially the blood pressure, lying and standing blood pressure, and examine nerves, heart, balance, and vision. If you think about it from up downwards from the patient perspective, from the top of the patient till downwards, you can say it like this: a neurological examination, vision, balance, and heart. Neurological, vision, balance, and heart. Okay? This is in terms of the examination. Then the investigations based on the case. Based on the case. All right? In falls, you can think about ECG, and X-ray if there is an injury. Okay? This is in terms of the data gathering, history taking, examination and investigations. Then the management. The management will be based on the case. All right? So, falling. Falling is an event. It's an event. All right? Please try to remember this picture when you have a fall. So, as I mentioned, it is an event. In the event, you need to ask what happened exactly. When did the event happen? What happened before the event? What happened during the event? And what happened after? All right? So when you ask what happened exactly, you ask the patient an open question. Can you tell me what happened exactly? Then the patient will tell you what happened in his own words. All right? This is an open question. Then you think about when. When did the fall happen? Why? When you know when did the fall happen, this will help you, especially in stroke, or if you suspect a stroke or TIA. Why? In stroke or TIA, there is a window, 4 hours window. If the patient receives the treatment before this 4 hour, the outcome will be promising. All right? So that's why it's important to know when exactly the fall happened. All right? And before, you remember this lovely man, the man with the heart, man with heart. If you take it from up downwards, okay, if you take this man from up downwards, the man has head, has ears, has heart, okay? You ask the patient, is there any specific thing happened before this fall? Any headache? Any headache, why? To exclude space occupying lesion. If the patient has severe headache, especially in the morning, so you think about a space occupying lesion. Any ear pain or ear problem? Ear problem or fullness or ear pain to exclude the balance or the inner ear problems. The patient can present with a fall due to an inner ear problem, okay? So you have to exclude this. Then you think about the heart. You ask the patient, any shortness of breath, any chest pain, any palpitation, all right? This is in terms of before. Then during. In during, you ask the patient, how did you land on the floor? You have to know the mechanism of the fall. Why? Maybe the patient landed on his head. So you have to exclude any injury to the head, and you have to ask about vomiting or symptoms of concussion. And in your management, you will include CT and X-ray on the skull, all right? So this is in terms of during. How did you land on the floor? Or how did you fall down? Then, how long have you been on the floor? Especially in elderly patients. Long lie, you have to exclude long lie. Long lie can lead to rhabdomyolysis, and rhabdomyolysis can lead to acute kidney injury. All right? So for how long have you been on the floor? Any loss of consciousness? Any fits to exclude epilepsy? Then fast. What is FAST? FAST is a mnemonic, stands for the symptoms of TIA or stroke. All right? F for facial weakness, A for arm weakness, S for slurred speech, T is for timing. If you didn't ask about timing here from the start, you can ask about timing here if the patient tells you, yes, I have facial weakness and arm weakness. So you ask him, since when, or do you still have the problem or not? Okay? Then after the fall, you can think about injuries. Was there any injury to your head or any part of your body? All right? These are the differentials that you can ask about in falls. If the patient gives you everything negative in these questions, you can think about this box. Any specific thing happened before the fall, like slipping or tripping over? Any problem in your sight? Maybe he tripped or slipped over because the problem in his vision. All right. Did you skip any meal to exclude hypoglycemia? Did you drink any alcohol? All right. Alcohol can lead to hypoglycemia and can lead to balance problem. And this is one of the well-known causes of falls. You could have it in your exam. All right. Then in anything else, if you missed something here, you can add it here in anything else. All right. Do I need to ask all of these? Well, it's based on the context or the simulator. All right. If he tells you something positive, go with it. Don't dwell and drill on every single differential diagnosis. If the patient gives you a positive history of severe headache in the morning, so this is most probably a kind of space-occupying lesion. If the patient gives you a positive history of ear pain or fullness, so this is most probably something related to the inner ear, like vestibular neuritis, paroxysmal positional vertigo, Meniere's. All right. Yes, the main symptom with ear problem is dizziness, but you never know. You can have it as a fall in the exam. All right. If the patient gives you a kind of positive history of palpitation or dropped beat, so you think about stock Adam attack or heart block, all right? So it's based on the case and based on the positives of the case. If the patient gives you all of these negatives, so you ask about during, and in during, you ask these and you ask fast, the patient might tell you, doctor, yes, I have facial weakness and arm weakness. All right. The patient might tell you from the start, I have facial weakness and arm weakness. So you have to think about TIAs or stroke. Okay. So it's based on the context and based on the case. Okay. As long as you are going smoothly in the questions and in the logic way of thinking, the simulator will help you. They are not there to trick you or to fail you. They are there to help you. If you are moving smoothly and they can see that you are going logically, they will help you. All right? So this is the present history in falling. Okay? Then you move on to the past history. In the past history, you ask the patient, Mr. X, do you have any medical condition I should be aware of? Why you need to ask this? He might have high blood pressure and he's on medications, and this the dose of the medication has been changed, so he might have postural hypotension, right? Then you ask any medications that you are on. These are the important points in the past history in falls. No need to ask about family history here. It's not related at all. Allergies as well, not related. Okay. Personal history is not important in falls. I mean, diet, exercise, smoking, and alcohol. You can skip them. Don't waste your time. Personal history is important only if you suspect TIA and the patient had the fall 1 or 2 days before. The patient is stable and he's telling you, doctor, I had a fall 2 or 3 days before. Then you can ask about personal history because this is one of the risk factors of having TIAs and strokes and heart attacks. So you can advise the patient on them. All right? But if the patient has the fall now or had the fall 1 hour ago and he is still having facial weakness and arm weakness, do you think that asking about personal history is important here? No, it is not important. Okay, skip it. Skip it and don't waste your time. All right? 4 P's is not important in falling. Psychosocial is very, very important in falling. You have to check the patient's safety. You have to find out who does the patient live with. Is the patient dependent or independent? If he is elderly patient, okay. What else? You can ask about driving if the patient is going to go home. So you advise him on avoiding driving. Okay. So these are the points that you can include in psychosocial part in falls. Then ideas, concerns, and expectations. Do you have any idea what might be causing this fall? Do you have any concerns at all? Any expectations from our consultation today, Mr. X? Okay, then the examination. In the examination, you think about the observations, lying and standing blood pressure. Then the local examination, heart, nerves, balance, and vision. In investigations, you think about ECG and X-ray. Bloods, you can just include it in as a basic investigations to the patient. All right? Then you manage the case. In the management, please think about what we can do as doctors in terms of hospital admission or referral or medications or reviewing medications or giving an advice. The patient's role, what you can do to what the patient can do himself in terms of lifestyle modification or safety at home, giving leaflets to the patient, safety net the patient based on the case, and follow the patient up. These are the main points that you think about in the management of falls. Okay? Always think about the management as a kind of mutual responsibility between you and the patient. You will do few things to the patient, and the patient will do few things to himself or herself. Okay? All right. This is in terms of falls. What are the popular cases that you might face in the NHS or in your exam? In falls, you can find postural hypotension, especially if the patient has high blood pressure and he has increased the dose of increased the dose of the blood pressure medication or changed the dose. All right. You might also find space occupying lesion, especially if the patient gives a positive history of severe morning headaches or blurry vision. You also might face the cases of dizziness, the inner ear problems, like vestibular neuritis, benign paroxysmal vertigo, Meniere's, all of these are causes of fall. Okay. Stroke and TIA, you can find them, or you can face them in the NHS or in the exam. Drinking alcohol, if you ask the patient, is there any specific thing happened, like skipping meal or drinking alcohol maybe, and he gives you a positive history of drinking alcohol, so this might be the cause, one of the differentials, right? And lastly, mechanical falling on maybe any part of the body, you know, on outstretched hand. This is one of the popular cases as well. All right. This is in terms of the cases that you might find in your exam and in the NHS as well. All right. In the next mock, we will do cases on falls, so you consolidate your knowledge about falls, and when you have a fall in your exam, you are not going to fail, inshallah, in this case. All right? Okay. Thank you. Thank you. Thank you. Thank you. Thank you, Dr. Abdul. Thank you. All right. Okay, doctors. So have a good night and nice dreams, inshallah. And yeah. Okay. Bye-bye. Bye.